Starting tomorrow, every drop of blood collected by the Red Cross in Canada will be tested for AIDS. 5 Canadians so far have caught the disease through blood transfusions, and the Red Cross wants to make sure that no one else gets infected. Eve Savory, our medicine and science specialist, has the story.
Could you please read these 11 questions, Sean, see if they applies to you?
The questions are designed to keep anyone who might have been exposed to AIDS from giving blood.
Everything applies? Okay.
The blood test is designed to ensure it.
The blood is as safe as it can be. It's tested by a very sensitive test, and we think that the problem of AIDS is licked.
Chicago, the Abbott Laboratory. These are the people who will supply over 1 million test kits to the Canadian Red Cross every year. It is not a test for the virus.
The reason we can't look directly for the AIDS virus is because it's not really floating around and easy to find, because it's hiding within cells and it's not inapparent.
So they test for the antibody. When a foreign body, say a virus, invades our blood, we make antibodies to attack it. Usually that antibody knocks off the foreign agent and hangs around just in case it comes back. That's how a vaccine works. But with the AIDS virus, we make antibodies, but they're not much good at knocking out the virus. All the antibodies do is signal that the virus is, or has been, present. This is the test. A donor's blood serum is added to a special coated bead. This is the signal. If it turns yellow, the antibody is present. Canada's Red Cross has been testing for weeks, making sure all the blood on the shelves is ready by tomorrow. The results are preliminary, but it appears about 400 in every million units tested will be confirmed positive for the antibody. Since Canada collects over 1 million units a year, in the last 12 months we've probably transfused at least 400 units of blood and its components carrying the AIDS antibody. But will all those people get AIDS?
I have no idea. I doubt it. I don't think anybody knows the answer to that question now.
And that's one of the problems with the antibody test. It looks as if about 2 out of every 100 people who have the antibody are going to go on to get AIDS every year. But which 2? And are the rest infectious? Could someone be a carrier for life?
Clearly, some of the things that we're looking at downstream would be tests that are more definitive, tests that can tell an individual whether he or she is infectious, what's the likelihood that they will develop AIDS or hopefully won't develop AIDS.
Because the AIDS incubation period can be 5 years or more, it'll be a long time before we'll know how many people will develop AIDS from past blood transfusions. But starting tomorrow, the antibody test will almost guarantee there will be no more AIDS in Canada's blood supply. Eve Savory, CBC News, Toronto.